So you're here wanting to understand what is parent-child interaction therapy, what is PCIT, and I love telling people about PCIT. And I think what you probably really want to know, which is the thing I would want to know, is how can PCIT help my family? So who am I to tell you about PCIT? My name is Leah Klionsky. I'm a licensed psychologist with specific expertise working with young children. I've been working with children for many years, especially the littles. I love working with them. And I have over 15 years of clinical experience. I'm also a PCIT expert. I was trained and mentored by the developer of parent-child interaction therapy. So what that means is that all of the research I did as a graduate student was in parent-child interaction therapy. It's the subject of my master's degree, my dissertation. It was the cases I was seeing right off the bat in 2007 when I started. And it means that I have a lot of direct mentorship from the developer of PCIT. And now I'm the regional trainer of Texas. What this means is I have specific certification, high-level certification from PCIT International to train any of the therapists in Texas in PCIT. And I personally have helped over 500 families using PCIT. So I've seen about everything at this point, and I've used PCIT with many different people and helped many different families using this treatment. And at this point, I've probably seen even more than that if you're watching this video any later than 2 days after I made it. I've done PCIT in pretty much every setting you can think of. So I've worked with families in research clinics, in the fancy research clinics, in community mental health, in private practice, and now virtually. I love virtual PCIT. And I also direct a clinic full of other PCIT experts. So I am very picky about who I bring on to do PCIT in our clinic. I only bring on people who are as good as or better at PCIT than I am. Love the clinicians here. So the other important thing to know about me is I'm a mom. I have littles. I have a 5-year-old, I have a 2.5-year-old. They are wonderful and they are real kids with lots of personality. And I use all of the skills that I use in PCIT with my own children at home. And if I did not use those skills, I would be very, very stressed out. But I'm in the trenches with you. I know what it's like from a clinical perspective. I also understand it from a parenting perspective because there I am doing the same things you're dealing with, having the same kinds of tantrums at times, helping with the big feelings. So what is PCIT exactly? And how's it different from everything else that you've tried? How's it different from parenting books you've read, from TikToks you've watched, from reels you've watched, from people you've talked to? What is different about this? So PCIT is a parenting skills training program for young kiddos aged 2 to 7 years old. And the goal of PCIT is to target your interaction. So we help you change the way that you respond to your child. And that in turn changes the way that they respond to you. So we're really working on your relationship and your communication. It was created for kids with acting out behaviors back in the 70s. That's what it was for. But now, after 40 plus years of research in some adaptations, we know that PCIT can help a lot of other different children and families as well. Children who have trauma histories, kiddos with anxiety, kiddos with autism diagnoses, or kids with emotion dysregulation. Emotion dysregulation is fancy words for big feelings that you don't know what to do with and you don't know how to help with. So now PCIT is one of the most prominent evidence-based practices and empirically supported treatments for young children with acting out behaviors. And when you learn PCIT, you're learning new ways of responding to your child. You're learning how to reinforce good behaviors so they keep happening. Your child sharing with their brother, fantastic. You can help keep that behavior going on. You learn how to pay less attention to problem behaviors. Sometimes kids do really big things to get our really, really big attention. And if we don't give them so much attention for some of those behaviors, they're not interested in doing them anymore. We can help kids identify and regulate their feelings. We can help them improve their play and social skills. We can help them decrease hitting or other forms of aggression. Hitting you, hitting classmates, hitting teachers, that kind of behavior really makes it hard for kids to be successful. We can help you to get your child to listen to you without having to yell at them, because it feels awful to yell at your child. And we can help you build a trusting, safe relationship. So what we're really doing in PCIT is we're teaching you the skills that therapists use. And we're helping you tailor them to fit your specific child. All children are different. All families are different. All situations are different. But we can help you take these skills that really work and then use them with your family so that your situation improves. Your child didn't come with a manual. Wouldn't it be so nice if they came with a manual and you could take it home and you can know exactly what to do when they're 2 and doing this, and they're 4 and doing this, and you're feeling lost and confused and overwhelmed. But at this point, trying to decide on a parenting approach feels overwhelming. You can get too much information. It all contradicts each other. Just like when you try to eat healthy and one place tells you to go vegan, that's what real healthy food is. And another place tells you to do the Atkins diet. It's all confusing. How do you do this? How do you raise this happy, healthy kid that you want to have? And we're here to help you not be so overwhelmed. We're here to give you some tools, some specific tools, and make them work for your family. There are a lot of reasons families decide to start PCIT. So these are some of the common ones. Sometimes it's the traditional one, acting out behaviors or tantrums. That's one of the big reasons people come in. Sometimes it's big feelings. A child just seems so angry. They just seem so overwhelmed. They just seem so distraught over things that seem little to you. How can you support that child? Sometimes you're dealing with not listening. You've told your child to do something 150 times and they still do not put on their shoes. Sometimes they've been asked to leave school or daycare. That's really painful. You've been told that they just can't stay there, that they're not able to behave well enough to stay in that classroom. Or sometimes they send them home and they tell you, go talk to your child about how they should listen more at school. And you're like, I don't know what to do about this. I told them to listen to you. I don't know what you expect from me. Sometimes things are going fine, but you can anticipate there's going to be some potential big feelings, like there's going to be a new sibling, or maybe there's a divorce, or you're moving, or there's a new step parent, or there's something big changing. They're going to a new school and you kind of want to get ahead of that. Or maybe you haven't gotten ahead of that. Maybe the new sibling is born and now all of a sudden your child who used to connect with you really well is starting to struggle and you don't know how to help them. That's a great reason to come to PCIT. Sometimes your child is really anxious. Small things happen. They seem really overwhelmed. They react in big ways. Sometimes they're not getting along so well with their friends. Maybe they're not making friends. Maybe they're fighting constantly with their siblings. What do? PCIT helps with that. Maybe they have low self-esteem. Maybe they say things to you that break your heart, like, I'm not a good kid. I only do bad things. I make bad choices. We don't want your child to think that about themselves. PCIT can help them to see themselves more positively. Or maybe you've just received a diagnosis like ADHD or autism, and you're trying to understand, how do I parent this child? How do I connect with this child? How do I understand them a little bit better? That's a good reason for starting PCIT. So during PCIT, there are 2 phases of treatment. In the first phase, we teach you to be a play therapist. You learn specific research-based skills to connect with your child. You learn how to create short but meaningful play interactions to improve your relationship. So we don't just say to you, go play with your child and connect with them. We teach you, these are specific things you can do and not do in your play to have a really warm connection and follow them and play along with them. And then we teach you how to get meaningful changes in your relationship by playing with them for only 5 minutes a day. If you can give that high quality vitamin of positive attention, only 5 minutes a day, you can see a huge change. We can help you increase good behaviors that are already happening. We can help you use these same skills outside of the play during your day to keep improving the behavior you see around the house. A lot of kids get better just through this part of PCIT. Some children don't even need the second phase. Some children do, though. Some children still need help learning how to follow directions. And so in the second phase of treatment, we teach you how to improve big kid listening. One of the key parts is we teach you how to communicate effectively so your child knows when you're serious about listening. When do you tell your child to put on their shoes and you really mean it? And when do you tell them to put on their shoes, but you don't really mean it because, you don't really have anywhere to be? How can you communicate when you are dead serious without having to raise your voice? How do you parent from a calm, non-emotional place? If your kid is refusing to listen to you, if they look you right in the eye and they say, I don't have to listen to you, it'll make you angry. It makes everyone angry, and you're going to have an emotional response. How do you parent in a way that's consistent and calm without escalating and making things worse or doing something that you're not proud of? How do you set limits and boundaries so that you can take your child out into places and help them be in the world with you? How do you use discipline strategies in a safe way? How do you know how to implement something in a way that's predictable and not damaging to your child? And how do you use skills from home and bring them into public, right? We live in the world. We need to be able to take our children to the grocery store and to Target and on an airplane and to grandma's house. PCIT will help you take these skills from home and use them when you need to. The thing that makes PCIT really work for you is there's a coaching component. So we don't say to you, use these skills, go home, come back next week, tell us how it went. Oh no, we're going to watch you. We're going to watch you play with your child, and then we're going to coach you in the moment so that you get really, really good at using those skills. This lets us understand your interaction. What's going well? Where do you need some help? We get to understand your environment. We do PCIT virtually at PCIT Experts. So we're able to watch you at home and really help you with any of the questions you have with the situations that come up in your house. We're able to give you immediate feedback right in the moment when things are going on. If you're in trouble, we're there. We can help you. Things are going well, you're getting it right. We can help you understand what exactly it is you're doing that's working for you. It's like the difference between going to the gym with an app versus going to the gym with a personal trainer. If you go with the personal trainer, they understand you. They're watching you. They're watching your form. And the minute that they can see what's going on, they can help you tweak things so you get much faster results. And then we can also help you decide what are our next goals going to be. Are we ready to move on? Are we ready to end treatment? So this is how coaching is set up if you're in a clinic-based PCIT clinic. All right, this is how we did it in the olden days. This is how I did it when I first started doing PCIT in a lab. So you're in one room playing with your child, your therapist is in the other room watching you through a mirror, and we're there coaching you during the interaction. So this is old school PCIT. Virtual PCIT is a lot simpler. You have a therapist at a different place entirely, watching you on their computer, and then you're playing with your child at your home, wearing a little AirPod or some sort of earpiece so that we can talk to you. I'm going to give you a little demonstration of what this can look like. This is no one from my clinic. It's just a video I found on YouTube, but I really like it. It's a good demonstration of what PCIT can look like.
Taking the green block on your finger.
Nice behavior description.
Green block on my finger.
Beautiful imitation.
You're sticking the blue block on your finger.
Nice description. Those are keeping him engaged.
You're taking my green block.
Oh, you do a sharing.
So you see how she's watching the interaction and she's coaching that parent? The child can't hear her, but the parent can hear her. Even though they're not in the same place, this is what PCIT can look like. During PCIT, we measure your progress to make sure it's working. We watch how you play. We watch what your skills look like. We watch what the interaction looks like so that we can tailor it. We also have you fill out measures of behavior so that we can track your progress if behavior problems are something you're coming in with. We do little graphs. We know when it's going well. If it's not going well, we know how to help you. So how long does PCIT take? Is this something you have to do for months and months and months? And also, is there anything we can do to make it work faster? Because if you're dealing with big feelings or acting out behaviors or stressors in your family, you don't want it to take a really long time. You want to see improvement right away. So the good thing is PCIT doesn't take that long. It takes around 3 to 4 months. That's if we do it once per week. That is traditional parent-child interaction therapy. Now, there's some caveats to this. It works that quickly if you have a good therapist and also if you practice. If you are using the skills at home, if you are embracing the skills, if you're doing what you're supposed to be doing on a daily basis, you're going to see progress very, very, very quickly. And this is in 3 to 4 months is how long it takes usually to get through the entire treatment. You should often see progress in, just a couple of weeks if you're really doing it correctly. However, if you're not doing it, then you're not going to see progress and it's going to take a lot longer. Kind of again like that gym analogy, right? If you work out the way that your trainer tells you to, you're going to see progress a lot more quickly than if you just never go to the gym in between sessions. When you graduate from PCIT, we want to make sure you're really good at it, that you know how to use your skills, that if you were dealing with behavior problems to begin with, now those behavior problems are gone, and that you feel comfortable managing things on your own. We do also offer PCIT intensives. So sometimes we can get results twice as fast. If we do 2 sessions a week, we can maybe finish PCIT in only 8 weeks. Now, not all families are appropriate for this. If you're interested in this, let us know and we will assess whether your family is a good fit for us to do an accelerated intensive. Does PCIT work? Right? If you're going to invest in this, if you're going to do the hard work, is it effective? Well, the good thing is we know it's effective because we've been doing PCIT research for a very, very long time. There are over 40 plus years of research in PCIT, and we know that it reduces problem behaviors and it reduces parenting stress. So parents are a lot less stressed at the end of PCIT. It reduces status and anxiety in children. We know that the gains last over time. If parents continue to implement the skills, they continue to see the same improvements. We also know that the siblings of children who received PCIT also improve. So that's because you're learning skills for how to interact with your child differently. And if you use those same skills with your other children, you're going to see benefit across the board. So you can help every child in your family by treating one child using PCIT. Another interesting thing that happens is that children's behavior improves in school, even if the intervention doesn't happen at school. So if you do PCIT at home, your child's school behavior will improve, which is kind of hard to understand. I think it has something to do with kids feeling more regulated in general, kids understanding boundaries more, understanding when adults are telling them to do things, kids just feeling better. But we're not exactly sure why that works, but it does. PCIT is widely respected. It's recommended by the CDC, by the National Child Traumatic Stress Network. It's considered best practice for the prevention and treatment of child conduct problems and child maltreatment by many organizations. So this is not something we made up. This is something that has really been out there for a while. And that basically all PCIT therapists love doing PCIT because it's fun to do something that works so quickly. So one question people ask me all the time is, well, will virtual PCIT work? Because anything we do in person has to be better than anything we do virtually. Or is that true? So there was some early research on PCIT before the pandemic. So the pandemic was the reason why a lot of us moved into virtual PCIT. But there already had been some initial studies in 2015 and 2017 that showed us that virtual PCIT was working really well. And that's part of what made me comfortable transitioning my clinic when the pandemic hit. Now there's more and more research coming out all the time. Virtual PCIT is where the research is at this moment. One of our clinicians and PCIT experts does research on virtual PCIT as her day job, and then she sees some clients and families for us using PCIT in the evenings. So this is going to keep changing. What I'm going to talk to you briefly, though, is about this 2017 Comardal study, because I think it's really interesting. So this study was done in 2017. It was with 40 children with acting out behaviors. They put half of them in that clinic-based therapy that you saw with the with the mirrors and the family on one side, the therapist on the other, and they did half of them in virtual PCIT. And what they found is that both treatments worked. Kids got better, families liked it, they wanted to stay, everyone was satisfied, they saw those gains 6 months follow-up. This is normal. This is what we almost always see for PCIT in the clinic setting. But then some interesting things happened in the virtual setting as well. So there were some clinicians who were supposed to observe families without knowing if they were in virtual or clinic-based PCIT and kind of say, how good are their skills? And getting your PCIT virtually was associated with a higher rating of an excellent response. Also, people who received internet-based PCIT had fewer barriers to treatment. That's one of the best things about virtual PCIT is that you don't have to try to find someone in your area that you hope knows what they're doing. That you're like, oh, I hope you're certified in this. I hope you're experienced in this. I hope you can actually help me with this treatment. Well, now you can access high quality PCIT in over 40 states. So psychologists have something called PSI-PACT, which means that if you are licensed in a PSI-PACT state, for example, Texas, where I'm licensed as a PSI-PACT state, I can practice virtual therapy in every other PSI-PACT state. And there are 40 PSI-PACT states, so most of the United States. And that number keeps growing as well. So what this means is that you can access this high quality care pretty much wherever you live, unless you happen to be in those 10 exception states. So that's so nice not to leave your home, not to have to rearrange your schedule and drag your child out when they don't want to put on their shoes. And that's the reason why you're coming in the first place. Also, PCIT works. As someone who's done it every single way I can think of, when I switched to virtual, I immediately noticed that it was more effective. And this is what many other PCIT therapists tell me as well. All of our experts agree that you need fewer sessions of PCIT to meet goals. Families just progress faster through the treatment. It's more natural because it's where your child lives, so they're more comfortable. They act the way they normally act instead of putting on a front because you're in a clinic. It's more easy to do it because you know how to practice in your own house with your own toys, so it's easier for you to learn the skills. Parents are more confident. We can address real life problems. So if your child won't turn off the TV in your living room, we can practice turning off the TV in your living room. It's also really easy to do. Sometimes parents worry, oh, the technology, this is going to be so hard. It's not hard. All you need is some way to participate in the session. That can be a computer, it can be an iPad or tablet, that could be any kind of smartphone. You need some way to listen to the therapist. So any AirPods or headphones that you can plug in, and you need your child and toys, and that's it. So in a second, I'm going to show you a demo. Okay, so it's me pretending I'm doing therapy from my office with my daughter and husband who are in the playroom. So we're in completely different locations. I'm joining through my computer. My husband is joining through his iPad, and he's using AirPods. And I just want to show you how easy this is to set up. And just a little taste of what it looks like, just a tiny bit. And you can also see how cute my daughter is. She's really pretty cute. Hi. Hi, Todd. Hi, Ella. Is our technology working? Can you guys hear and see me okay?
Yes, we can hear and see.
Fantastic. Okay, so we're going to get ready to do some fun special time. Can you show me the toys that you brought for us to play with?
Yeah, ice cream set.
Perfect.
And we got a car garage and magnet tiles.
Excellent. Ooh, Elle, are you ready to have fun with your daddy? Yeah, fantastic. All right, so what I'm going to do is I'm going to have your daddy put an AirPod in so I can talk to him, and I'm going to go invisible. All right, and I'm just going to watch you play, and your only job is to have fun. Does that sound good to you, Elabella? Yeah. Fantastic. All right, so can you put on an AirPod, Todd, and we'll make sure it's working?
Sure.
Okay.
All right, can you hear me well?
Yep,
That's
I can hear you.
fantastic. Perfect, and now Ella cannot hear me.
Oh,
All right, so
I
I'm going to
want
be
chocolate chip ice cream, Ella.
invisible, and I'm just going to watch you, and then I'm going to coach you, okay?
Okay.
So that's how easy the setup is. That's it.
Yes, I do on hot fudge.
Oh, you got the
Where's
scoop.
mommy?
Oh, she went invisible.
What's she saying?
Ooh, chocolate. Just hot fudge. My favorite.
There's that sprinkle part.
Oh, good job putting the sprinkles on.
And the hot fudge doesn't work.
Hot fudge doesn't work.
Yeah.
That's okay.
That's good for now.
Okay, now I've watched you for 5 minutes. You did a great job with lots of labeled praises. So I'm just going to coach you for another couple minutes, okay?
Okay, sounds good.
I'm going to work on continuing to praise.
Oh, yummy ice cream. Made vanilla and whipped cream and cherry. Is that your favorite?
Yeah, that's my favorite.
Good job getting a scoop for you and a scoop for me.
Really nice praise there. She looks so happy. It's okay if you want to pretend to eat your ice cream too.
Yeah. I don't have that car.
Oh, we got the car too?
What's
Wait,
that car?
reflecting.
I think we just had the blue car in the truck. Do they like ice cream? Yum,
They
yum,
don't
yum.
like ice cream. They don't eat ice cream.
They don't eat ice cream. They just
Excellent
like to be
reflection.
cars.
They just like a big car.
Yeah. Yummy.
All right, so now you got a little view of what that can look like, and you also got to see. I might be a little biased, but I think she's pretty adorable. Okay, so super easy to do. So if this appeals to you, if you want to see these changes with your family, schedule a call with our intake specialist to learn more. We can help you find the perfect therapist for your family. All of our therapists are very good. I'm extremely picky. They are certified by PCIT International. Most of them have helped at least 100 families with PCIT, often 200, 300. A lot of our therapists are also PCIT trainers, so they really know what they're doing, and we can help you in all SIPAC states. So I'm really excited that you learned more about PCIT, and we hope to hear from you and help your family.